Okay.
Hello, everyone. We are here with Division 29's Who's Who, and today we have Dr. Beverly Greene here with us. We're very excited to have her join us. But let's jump right in. I would love to hear about your educational background and your professional experience.
Well, I am proud to say I'm a product of East Orange, New Jersey public schools, and that my experience as a public school graduate is that public schools can be every bit as good as any private school there is. If the educational process and teachers are given resources and support. Um, for much of the time that I was in grade school, I would say K through six, um, we were sort of divided up in classes based on test scores. And so I had the good fortune of always being in classes with students who at least the teachers were told these are the smart kids. So, you know, treat them as such. And it sort of bore out what we now know as a result of research in education that when you treat kids as if they're smart, even if they're not, they perform better. And so I was surrounded by folks who all performed very well because we were treated as if that was the expectation.
Mhm.
Um, I went to NYU for my undergraduate work and then to the Derner Institute for Advanced Psychological Studies at Adelphi University for my doctorate in clinical psychology.
Wonderful. Thank you so much for sharing that. I'm also a New Jersey public school alum, so from northern New Jersey. But um,
Okay.
yeah, thank you for sharing that. So after you graduated undergrad, what inspired you to become a psychologist?
Well, I think I made that decision before I graduated. Um, I was one of the influences is that I got into therapy my freshman year in college. And so I was coming to appreciate the nature of the process of therapy and how it facilitates self-reflection and self-assessment and other things. Um, I was finding that, particularly after taking abnormal psychology, that I liked my psychology courses much better than I did the pre-med courses that I was taking. And while I'm sure they were connected, I didn't really appreciate a connection between what I was taking in the coursework and what I would be doing as a physician. But I could make that connection in in psychology courses, and I think also being in therapy at the same time helped to make those connections. Um, I think by the time I was a sophomore, um, I was a resident advisor in the dorm. And as part of the therapy process and that process of self reflection, I was noticing that often people, some who were friends, some who were just students, would come to talk to me about things they weren't talking to other people about.
Hmm.
And that I, again, as in part as a function of therapy, um, I learned to appreciate that that's not true of everybody, that there might be something about me that made it easy for people to talk to me about things that were disturbing, things that they had fears about, um, and that I was a good listener. And that I needed, since I couldn't see myself any longer in a career in medicine, I needed to think about what my skills were and what I might do with that and what that would look like. And so doing psychotherapy became something that I was thinking about. And in that process of self reflection, I also thought about um, because I was encouraged to think about my own temperament and personality and what kind of work that would make me suited for. And of course, I couldn't see myself, let's say, working in an emergency room where every day I was going into chaos and the unexpected, um, but where interacting with people in a more um, directly engaging fashion, that I could talk to people, um, that there was time, that you didn't have to make decisions every second, um, about what are you going to do about something? How are you going to fix this? That therapy is not about fixing people, um, but helping them engage in a process that helps them really help themselves. Um, and so I thought also about what were the kinds of things therapists did vis-a-vis my own therapy. And I sort of figured out, although I didn't have the language at the time, that I had good boundaries. That of the sort that therapists need to have. That you need to be able to listen to people and have compassion and respect for their dilemma. Um, but it's not your dilemma. That you have a certain compassion for what is happening to them, but you don't lose the sense that it's not happening to you. And if it were, you wouldn't be of much help to them. And so, uh, again, in that process, I sort of thought, this feels like this would be a good fit for me.
Wow.
And so that was how and I focused on it more around being a psychotherapist, not necessarily a psychologist, because it wasn't the research that drew me or connected me to the discipline. It was psychotherapy and the histories of psychotherapy and theoreticians and stories about those theoreticians and where they came from, and um, the notion of, if you one looks at Freud's work, um, back then, I certainly was aware of the Holocaust and what happened to a lot of intellectuals during that period. And thinking about someone like Freud, who had to flee his country, who came up with all of these incredible ideas, not all of which were necessarily progressive, but that he had to have been affected by that. And it gave rise to these incredible ideas and things that we were seeing. And just I had an interest in understanding people's inner lives, that we have an inner life. What is that? How does that shape what we do and how we think and how we feel? And so it was in that way a really good fit.
Yeah. So it seems like you knew you wanted to be a therapist before you had the words to say that you wanted to be a therapist. And
Yeah.
you already began to debunk these ideas of therapy, like therapy is about fixing people. So what other misconceptions would you say are part of the field?
Well, are you asking part of the field of therapists or misconceptions of lay people about therapy?
Ooh, both. Either would be fantastic.
Okay. I think among therapists, sometimes there is still a feeling of needing to fix people, to make them correct, to make them, um, and this became a significant interest for me as a psychotherapist once I left graduate school, because I didn't see any of it in graduate school, was trying to understand how people's circumstances, and not just their internal processes, shaped how they thought about things, how they saw things, and who they became, in terms of better understanding the world of marginalized people, particularly people marginalized around race, around sexual orientation, around gender, that there were circumstances that people often found themselves in that were based on systemic inequities. It wasn't about whether or not they were trying hard enough, or whether or not their parents or their families were fit enough, um, but that there are systemic inequalities that therapy has to be willing to address. And that is something that I think for some, we've gotten a lot better, but for some therapists is still an issue. It's, sort of like, well, the question still comes up. Well, why would I talk about race in therapy? Well, how could you not if you're talking to somebody who's raced? How's that not a part of the discussion when that's a part of their everyday world? And so I think an unwillingness on the part of some therapists to educate themselves about what those worlds and realities are like for people who are nothing like them remains problematic. Um, for lay people, I think the notion sometimes is the same misconception that some therapists have, that, you're going to get fixed. Therapy's not about fixing. Um, the other misconception I think among lay people is that if it takes time, that's a problem. And, all I can say is, well, it took time to get broken. It's going to take time to repair. Uh, the I think another notion that some patients have expressed to me is therapy is going to make me dependent. I'll be depending on going to therapy all the time. I'll never not be going to therapy. Well, it's just quite the opposite. Part of what therapy is there to help people do is to take that process and internalize it, so that when they're out and they're in situations that are problematic, they have some little voice, hopefully mine as a therapist, that says, but wait a minute, you don't have to make a decision about this instantly. You can stop and think about what you want to do or what you don't want to do, what's going to happen if you do A, what's going to happen if you do B, that we can think about things, that we can be um, in these situations where it's okay to ask for help, that going to therapy means you're asking for help. Why is that a problem? And I think both our field as well as lay people, because we live in this sort of uh, culture of the rugged individual. Well, that's a bunch of bullshit. Everybody needs help sometime, including therapists. Human beings are nurtured in their connection to other human beings. And sometimes we just need help. Sometimes you just need support. That's not a failing. That's not something that one needs to be self-deprecating about or afraid to tell people. Um, it's just about being human, and that it's part of, I guess, one of the messages to my patients, but certainly to people who have misconceptions about therapy, is part of being human is needing help, that sometimes you need help. And there's nothing shameful about getting help when you need help. The question would be, well, why wouldn't you? And so I don't know if that appropriately answers the question, but on both sides, I think those are certain misconceptions that
Yeah.
people you don't have to be perfect because nobody's perfect.
I
Everybody makes mistakes.
I was even thinking of the intersection between the two ways that you debunked this idea of um, we want to make sure that therapy is political and we are bringing our clients' identities. And if a therapist is having difficulty integrating that, then maybe they need more support in learning how to address it in therapy.
Yes,
Yeah,
because the history and nature of psychology per se has not done that.
right.
It has often colluded with um, dominant cultural ideology as normal, as healthy. And it's not necessarily either of those things. It's just dominant cultural ideology. And there are other ideologies that are just as valid. Um, and that therapists need to be adept at encouraging people who come from those different ideologies, that they don't have to be what the dominant cultural voice says people have to be,
Yeah,
but that they can find themselves.
yeah. So what would you say is the most rewarding part of your work?
Helping people to do the kinds of things I just described, helping people to um, be able to be more self-accepting, sometimes less self-critical, to be able to feel like it's okay to pause and reflect. Thinking is not a bad thing, that sometimes it's really necessary to stop and think about what you're doing before you do it. That impulsivity is not the only way to go about being in the world, but also that you can create your own narrative. And, the sense that we are not just what is inside somebody's head, that whatever that is, um, whether it is about social identities, whether it's about, um, someone who's raised to believe that they're bad, whatever has been given to you in terms of self-definition came from somebody else. And we have the right to say, well, what about their self-definition? And why is that right? Why is that the only way for me to look at me? And are there other ways I can be? And were there reasons that somebody else needed to see me in a certain way? Because they need to see themselves in a certain way. But to sort of um, maintain connections with people, but disconnect yourself from the ways that other people have chosen to define you. Um, I I remember when I was probably in junior high school, early high school, in many of the discussions in our family that we had about race, um, and our father talking to us about how um, we might not be seen in the same way as our white peers, that we might not be treated in the same way, and that our behavior could be the same, but it wouldn't necessarily be interpreted as the same. And that it was important to remember that um, you are not what somebody else, some idea somebody has in their head about you. That's what they have in their head, but that's not you. And only you can come up with who you are or what you need to be. And I think that that's an important piece of something I gained growing up that gets embedded into my work. You're not somebody else's idea of you. That's their idea. That's them. And they've got their reasons for seeing you that way, but that's not you. And so helping people to be able to make those transitions and see themselves more clearly, to appreciate themselves, to just to see that they can create their own narrative, that they're not the narrative somebody else created for them. Um, one of one of the nieces in my family who went to therapy when she was having a hard time, um, with a brilliant therapist who I will mention by name, Dr. Cheryl Thompson, who has since passed away, but who was one of my classmates at Derner. And she said one of the things that she gleaned from her therapy with Cheryl was the sense of that which was is not what is, nor is it what has to be. That we don't have to be imprisoned by our past. It happened. We can't do anything about what happened in the past, but we don't have to recreate it in the present. And if we don't recreate it in the present, we change what the future can be. And so helping people to be able to kind of get that piece is most rewarding. I don't have children of my own, although I have a gaggle of little nieces and nephews who are as precious to me as my own children would be. And there is a piece of therapy that is not unlike watching a child discover a piece of the world that they never knew for the first time. Um, Being there the moment one of my young nieces learned that a string of words, a string of letters that she made was a word, and that she could look at these strings of letters and they were words, and that if she could decipher the words, it meant she could read. And watching her excitement about just saying, I can read. I can read that this part of the universe was unlocked for her and would be open and unlocked for her forever. Um, those are defining wonderful moments about if you have children, when you're able to be there to see them unlock pieces of the universe for the first time. That's also wonderful in therapy, that you can see somebody discover something that they didn't know about some process that defined them that no longer has to. And they can say, I can think about that differently. I can make a different decision about how I do that. And the outcome will be different. Um, one of one of the sort of high points of therapy with a person is when I have a patient who comes in and said and describes some dilemma that happened to them and says, and I knew what you were going to ask me, because that means, yeah, yeah, you got this. You have this in you now. You don't need me to tell you. And so that is what is one of the powerful aspects of therapy and something that's really most rewarding.
Yeah, that moment of internalization is such a win in therapy, as you said.
Yeah.
Totally agree. So then what would you say is the most unexpected part of your work?
Um, I don't I don't know how much it was unexpected. Uh it's been I wouldn't if if I had it to do all over again, I wouldn't do it differently. Um it's been both intellectually as well as personally gratifying in ways that I don't know that I ever expected. And so if that's the case, I never I never expected that I would be writing about doing therapy or engaged in that level of activity. So that's been unexpected.
Wow, very cool. I love that idea of you didn't even expect and you allowed it to unfold. There's so much
Yeah.
potential there. So then what is your hope for the field of psychotherapy then?
that it becomes more accessible,
Mm.
that more people are aware of how helpful therapy can be to them and less afraid of all of the things that they fear around getting in therapy, but also that the services themselves can be accessible to a wider range of people. Um, there are, I mean, I have colleagues who've talked about this as well, that um,
Cat is
often,
joining us. I'm sorry. My cat
don't,
is joining
please don't apologize.
us.
The availability of numbers of psychotherapists, and I'm in New York City.
Mm.
So one would not think in terms of there being a shortage of psychotherapists here, but sometimes when I need to refer somebody, I can't necessarily readily find people who are available.
Right.
And in the times that we're in now, where there is so much political tension and polarization, there's so much division. Um, People who are marginalized even more, um, and are afraid. People who have a history of marginalization and who see things may get worse are also afraid. Um, and there has just been this uptick of people who are looking for services that are not always available. And so I would want to see therapy be more accessible to a wider range of people and also more sensitive to the struggles of a wider range of people, particularly people who are members of socially marginalized groups, because now things are getting worse. They're under attack. And that is going to warrant certainly explicit attention in therapy.
Wow. So would the remedy be more individualized and tailored directories for psychotherapists?
I don't think it's that. I think it's that people, a lot of people I know are just booked up.
Okay.
And they're not an excessive number of people, despite the perception, that New York City is the capital of psychotherapists. Well, yeah, there are a lot of us here, but a lot of them are seeing a lot of people.
Yeah.
And a lot of them are also doing other kinds of work as well. Um, as I did, with psychotherapy practice. I've been on the faculty of a university for over 30 years. And so that kind of work is intense as well. Um, so I think it's about availability and accessibility. We need to train more people. And the training process is one which should be rigorous,
Mm.
but should not be um, a wall of impossibility, that it's made so difficult for people to get into programs, or that there is such a paucity of programs, or that um, there are not sufficient faculty in programs, that universities aren't um, supporting psychology departments in terms of having sufficient faculty to take more people, because if you're going to train more people, then you need more people available to train them. Um, and so there are different parts of society that have some responsibility here. And certainly training institutes and universities have part of that responsibility. You need to train people well and get them out there. And there are all kinds of things that are a part of that. Um, we also need to have healthcare coverage that allows people to get these services without basically driving them crazy just trying to get those services. Um, and we need more things like clinics. Um, in You had asked earlier about some of my professional experience prior to beginning work at the university. I spent some time in public mental health at Kings County Hospital in Brooklyn, New York, in inpatient child and adolescent psychiatry. At Brookdale Hospital's partial hospitalization unit for children. Um, in the New York City public school system. We need to be able to have psychologists in public schools who aren't just doing testing and assessment, who need to be able to have the time and the room to see children. I mean, I saw a therapist my freshman year in college because I could, in part because it was free.
Right.
And so, had I had to pay for the kinds of services I was getting, I wouldn't have been able to afford that at the time. Many kids in schools don't come from families that can afford private therapy services. And so our schools need to be able to provide that. And particularly now that children are, um, as one of my young nieces went to her first day of school and came back home so excited about being in school. And she said, and we had drills, but not the fire kind. And we sort of were like, what kind? And she said, the shooter kind. And I must say, I caught my breath,
Yeah.
that these precious little ones are going to school. And she said, well, in case there's a shooter, we have to all go in the bathroom and lock the door and lay down on the floor. And it's hot and it gets crowded in there because there are a lot of us and it's a small room. But you said you lock the door and you don't open the door until the police come. And I thought, why are children in grade school worrying about shooters? And what is this doing to them? How is this affecting their learning experience? Because how are you supposed to learn arithmetic if you're worried about somebody coming through the school shooting people? Um, and so I think we need to devote more attention to that in terms of our research around what happens to kids in this day and age when now they're worrying about shooters coming into the school, but also having people in place in schools who can help them when they're dealing with what is the inevitable trauma and disruption that even if nobody ever comes in shooting, if you're walking around and that's a potential danger that you're carrying in your head, what does that do to kids and teachers? How are teachers supposed to teach if they're worrying about what they're supposed to do if someone comes to the classroom door and they may be a shooter, and how do they keep the kids safe and how do they keep themselves safe? That kind of insanity. When we talk about accessibility, that's a different kind of accessibility, but it increases the numbers of people who could benefit from therapy services.
I mean, you just answered the the hope for the field, but what about your own future plans? Does that have anything to do with what you would like to do in terms of
Well, I'm in the midst of writing a book with two colleagues, Marie Maville from Teachers College and Angela Ferguson from Howard University, um, that looks at liberation psychotherapy for LGBTQ plus people, and the theme is the rainbow that never was. Um, and the theme is how to think about how LGBTQ plus people have been treated both as individual and intersectional groups in the history of our field, why it makes some people wary. I mean, when you asked about misconceptions about therapy, I know certainly people of color who will say, well, therapists don't know anything about that. you know, or in my, or we'll say, well, in my experience, when I start talking about that with a therapist, it shuts down things because they don't want to talk about that. Um, Similarly, the stigmatizing history of psychotherapy with LGBTQ plus people, um, the current, like, we're still having discussions about conversion, quote unquote, therapies, or as Doug Haldeman says, we call them sexual orientation change efforts because they're not therapies.
Right.
They're not based on any kind of fundamental, solid theoretical orientation or guidance. They're just about saying gay people are bad and we should make them heterosexual. And so that we still hear discussions about that in terms of some states that want to remove prohibitions, um, to doing conversion efforts with minors, or to make those, as they are in New York City, considered forms of consumer fraud. That there are people who want to undo that. And so those are problems and challenges that we face and as psychotherapists in the field of psychotherapy, but they're also challenges we face as, people remember things psychology and psychiatry and organized mental health had to say about them as marginalized groups. And many of them are sort of like, nope, I'm not going there. Why would that be helpful to me? And so convincing folks that things have changed somewhat, though we can't say they're not still a part of of those discussions, um, in terms of gender variance, similar kind of process. Um, so those challenges are still there. And to say they're misconceptions, well, unfortunately, they're not always misconceptions. Unfortunately, there are still people in our field who behave that way, who are still insistent on imposing what is a dominant cultural narrative on everyone and reinforcing a sense of, if that's not what you are is pathological.
Right. Going back to the other misconception you shared of we're not here to fix people to the dominant culture, we are here to let them be curious about who they are.
Yes, we're there to help them find themselves, not tell them what they have to be.
Right. Wonderful. Well, thank you so much for being here and contributing your wisdom and all this wonderful information. We have about a minute left. Is there anything else you'd like to add?
Um, I think in terms of, part of what my niece said she took away from therapy in terms of that which was is not what is, nor is it what has to be. And that is that the future hasn't been written for people. It's always a work in progress. And that we always have the option of rewriting, revising, and editing that script as we go along so that people can become what they aspire to be, or at least they have the option to try.
Well, thank you so much. That quote is something that will stay with me. I can think of a couple of clients who will benefit from it. I know other people will as well. Well, thank you again. And this is Dr.